The prevalence of smoking amongst those who have, for example, above high school education, or certainly even college education, the prevalence of smoking is probably 10% or less. If you look at the prevalence of smoking amongst the lowest income, it's about 35%. And the reality is that the lowest income are overrepresented by ethnic minorities. So the work that we're doing with Navajo is primarily around changing or impacting policy. And so what we've been looking at specifically is the role of social networks. The Navajo people for many centuries have looked at tobacco as sacred, as a fundamental part of their culture and their life, and we respect that deeply. When we talk about tobacco in the context of our study, we talk about commercial tobacco that's being sold in a way that leads to addiction, that's used in recreational ways that are not sacred at all. We found very clearly that in both interviews and our network analyses, that a majority of the Navajo that we interviewed actually prefer not, they don't prefer to be exposed to secondhand smoke. The challenge is that there's certain environments especially like in casinos and places like that, where smoking continues and people are being harmed by that smoke. Now, it's up to the Navajo people themselves to determine if they want to end that exposure. Our job in this project is to understand how they are learning about that risk and to educate about that risk, and then it's up to them to decide whether they want to change it or not. What I have found inspiring since I've come to Mayo is a true dedication and a commitment to a broad array of populations. We've got the Office of Health Disparities Research, which is trying to address and support research that looks at the unique needs and challenges of various populations and to conduct research to improve the lives of those people.